Hari Om, everyone. Today we are going to meet a beautiful doctor, you know, Barkha Nagpal from Nagpur. She is an amazing person, such a wonderful soul too. She is a physiotherapy doctor and doula childbirth educator. And she is doing lots of program for conception, pregnancy care, and core stability program, pilots and body weight training, and trimester-wise exercises program, antenatal care workshops. She has conducted lots of program in Nagpur, and post-pregnancy care workshop and nutrition-related workshops and all. Welcome to our platform, Barkha. Barkha, I would like
Thank
to
you,
tell
Dr.
you one thing.
Kalyani.
Myself and Darshana, we cannot forget the days which we spent with you. You know, our team were wonderful. Was especially we all did our hypnobirth and childbirth education in Bangalore
Together.
and spinning babies and doula program there in Fernandez Hospital in Hyderabad. So
Yes.
we know that you have that lots of interest and immense knowledge in the field of physiotherapy, and you got into the pregnancy field and you are doing great work. My dear, in this platform, there are lots of young mothers and pregnant mothers who are here. Please give your valuable inputs on exercise. My dear, prior to that, let you introduce yourself first.
Yes. Namaste. I'm Dr. Barkha Nagpal. I'm from Nagpur. I'm a physiotherapist. I'm a childbirth educator. I'm hypnobirthing childbirth educator, and I'm a trained doula. So I'm in pregnancy care since more than 5 years, specifically. So I deal with women's health from preconception, like from different phases: preconception, pregnancy, labor, then post-birthing. Then after that, menopausal phase. So whatever important phases are there in women's life that I try to cover. So I think I have a lot of interest in pregnancy care. So there are so many things that happens in pregnancy where there is a demand of physiotherapists to come and intervene, because we cannot have medication and we cannot go for anything extra, I mean, besides exercise. And sometimes the pain that it happens, the healthcare provider, they sometimes says, live with it. How can you live with the pain for 9 long months? So I thought, why not get into this field and intervene into whatever things are required to deal with aches and pains and discomforts during pregnancy.
Yes, exactly, my dear. I would like to ask, Priya, to jump into that. I would like to ask you this. Being a great doctor, doing lots of service in this physiotherapy, which make you to jump into this field of pregnancy and childcare? And, what are the experience with this pregnant ladies, and the program workshops, what you have conducted at your place? What are the response you got received, and how they are taking it in a way? Could you please explain it with us, please?
Yes, when I started with this field, I couldn't see anybody dealing with pregnancy care here in my place. So I thought, why not start with something? And I was very much inclined towards gynec field. So but I was in physiotherapy. So I thought, why not take up the physiotherapy part of the gynec field? And as it is, I have done my master's of physiotherapy in cardiovascular and respiratory sciences.
Wow.
So it involves exercises, basically. So how to deal? So I was like, why not take that? And my interest is in gynae. So exercises, why not we get into the field? And one thing is very important is women pull women down. So we need women to empower other women.
Exactly.
So,
well said, my dear.
And most of the time, Kalyani, you will agree with me, nobody shares their positive experiences during pregnancy.
Very true.
They generally talk about, I went through this pain, it was not good, it was cesarean, I had a normal. So if you had a normal, promote normal. And if you have gone through that pain, you should tell, okay, do this so that you don't get it. And your pregnancy should be easiest, I feel. I think pregnancy, like you're nurturing one more life inside yourself.
Very true.
So that baby should be welcomed. You cannot just deliver. So babies are not delivered, pizza is delivered. Babies are being
Baby is not delivered, pizza is delivered. Wow.
Yes.
Awesome.
So I think, and this all I got to know because even I'm still in the habit of calling birth as delivery, being from the medical field. So I think after hypnobirthing, I came into it. No, this is birthing. You have to
Birthing.
welcome the baby into the world.
Yes.
That is and one thing is, there are many pregnants that have come across that don't know, meaning they don't know whom to go to if they are in some kind of problem. So now if they have aches and pains, whom to address to? Because because we know the healthcare providers are very busy. We have less number of hospitals for this big population. So what happens is, then whom to address? Because even they have so many patients. So they say, okay, hota hai. So it should not be hota hai. It should be go to this person and she or he will help you or assist you. I won't even say help. We will assist you have any kind of comforts.
Exactly, my dear.
My aim was getting into it so that nobody should feel alone, left over, because there was nothing for my end I could see going through pregnancy.
Yeah, I really appreciate your great intention, my dear Barkha. I agree with you. My dear, just I would like to ask you that I would please tell us what is the importance of exercise during pregnancy. Usually, even Darshan and myself have done that, Active Mama, fitness program for pregnancy. Still, it's very tough for us to convince mothers to move, to exercise, to do a dance with us, because they feel they really get afraid of doing all these things. But they should know that value of exercise and how they'll get the good blood circulation. By the good blood circulation, how the babies get good amount of oxygen and all. But still, you're the right person as a physiotherapist and doctor, and you have done lots of research on it. Could you please explain that importance of the exercise during pre-pregnancy and during pregnancy, and especially you're an expert in that trimester-based exercise also. Could you please explain in detail, my dear?
So, yes. Thank you, Kalyani. I would first of all say exercise is a boon. Exercise is a boon. Even if you're not exercising pre-pregnancy, this is the best time to start with exercises during pregnancy.
Lovely.
Why is it a boon? Because now you know that the body will be going through a tremendous amount of changes. How to appreciate those changes is when you're going to a person who is dealing with that. Now there is sudden, it happens that, that suddenly you are not able to accept the body image because now you're growing. So the moment you start growing, you're like, oh my God, I should eat less, but you're not supposed to eat less during pregnancy. Now, I want to reduce weight, this, that. So the moment you start appreciating yourself, you start loving your new image. So first thing is, it helps you accept the body image during pregnancy. Now, the other thing is, it helps you keep happy, because pregnancy hormone is a slightly depressing hormone. So it helps you happy. So if you're happy, the baby is happy. Then it release again endorphins. Endorphins are happy hormones, plus they are natural pain relieving hormones. So exercises again help you relieve the whatever you're going through. The moment you're happy, you're like, yes, I don't think I have any problem. So, and if the problem is there, it looks small. Now you're depressed, you have so many mood swings, and you're like, oh, even a small, maybe if somebody said you something or somebody changed the music you were listening to, they start crying. And it is even it happens to us during the premenstrual time.
Yes.
So, and that is the phase that you're going through because you're high on hormones. So you have to expect hormonal changes to happen. Now you will get sleep. That is one very important thing. And there will be very least amount of aches, pains, and discomforts because you're exercising. The joints open up. There's a hormone relaxin that gets released during pregnancy. So relaxin relaxes the joints and the muscles so that the baby can descend and be welcome in the world. So that is the process of childbirth. So because of that, you know that you need strong muscles to support them. Now, if your muscles are not strong, then what will happen is you will get, again, there's pressure on them, and that there is a unexpected weight gain also. For some, they've been so lean throughout the life, and they're like, you gain 20 kgs, 30 kgs. So you need that amount of strength in your body to expect and to be able to bear that amount of weight. Now, the chances of diabetes is less. During pregnancy, the chances of blood pressure, high blood pressure is less during pregnancy. The anxiety is low. Then the baby will get good amount of nutrition. Okay, we all know that the baby is going to get good amount of nutrition. Now, what else? You are happy, baby is happy. The baby will come out calm. They will be socially very active. And the developmental goals are very, you will see that the development of the baby is fast.
Exactly.
So is you are giving them the habit. Plus, when they'll come out, they'll be very calm. Calm is something which is required. Because if you have been panicking throughout the pregnancy, then obviously baby will get some amount of effect, because whatever we are doing, the baby is getting nurtured with those kind of emotions.
Wow.
So now the chances of getting diastasis recti is less. That is the split in the stomach front muscle that may occur if it is not taken care, because the abdominal belt will expand. So the moment it stretches, we are expecting that some may not get that diastasis recti. So it's not common, but if you have the idea, you know that you will work for it, that you don't get it. So I think if I'll there are so many boons of exercises that I think
wow.
we go on and on and on.
Yes, my dear. Yes, you're well said. If the pregnant woman do that exercise properly, she have that less risk of gestational diabetes and blood pressure and all. She is going to give a good amount of energy to the fetus and everything. That's well said, my dear. My dear, see, you have lots of program, and down south people may want to approach you.
Yes.
Could you please give
Yes.
your contact details for them to approach you?
Yes, yes. You may contact me on my mobile number, that is 9960727076, or you may contact me on www.drbarkha.com, that is DRBARKHA.com, or you can mail me at barkha.d.nagpal@gmail.com, or admin@drbarkha.
Awesome.
So these are my
exactly, because people from somewhere, then they may reach you through this. They will get your good guidance from you. Yeah, and then please proceed with your intense knowledge and immense experience in this field, my dear. Yeah.
And one very important thing is it starts your labor spontaneously. So we are a sedentary lifestyle, and we know that our work is not as laborious as our mothers had a work. So generally I come across our mothers did it, but they didn't require the classes. Why do we require? Because our mothers are very strong. They had the best food. They had the most purest forms of foods. So
Well
they
said.
had a very, and now we see they don't fall ill, but we fall ill more. So that is because the nutrition that is going in, that is not very great that we are getting. Everything is either preserved or chemical treated, 100% chemical treated, I can say. So whatever we are getting is not in the purest form. So we are not that healthy, not that fit, I can say, as comparatively, I'm saying. Now the other thing is they have done a lot of laborious work, because then I think our parents, when we are talking about, that is the time we had partition. So now you know that they did not get too much of maids and all. Now we have the liberty, plus the education we have gone through, our lives are sedentary. So we are sitting and working. So we need to invest more energy. That is why they did not require any classes. And generally they used to say, we were just doing this work and labor started and I delivered within like some time. So within hours, within a couple of hours I delivered. I just went to the hospital and delivered, because they are exerting. We are not. So we need to build up that strength so that the labor starts spontaneously. For that spontaneous start of labor. And when the labor starts spontaneously, we are at least, I think, 85-90% sure that we are going for a normal birthing process.
Exactly.
Okay, unless there is some untoward effects or something, but we expect that to happen. Now, if it is not starting, then there is induction, this, that. Now, there are exercises can be done during labor to ease the discomfort that we are having during labor. Then you can choose different kind of positions to deliver, whatever is comfortable, because you have gone through those positions. Now you know how to breathe, how to go with the body. So there are so many things that exercises does. I would also like to include that when should start with exercises? First and foremost question. That is the moment you are done with the first trimester, from 14th week onwards, you can start with the exercises. And even that is the time when the placenta is well settled, the baby is attached. So, you know, the placenta is at a good height, your uterus is ready. So start with the exercises then. And you can start, and you have to, I always say, exercise till the day you deliver, you give birth. So that is the time you have to exercise. So, and what kind of, Kalyani, any questions from you? Because I am going on and on.
It's interesting. I didn't want to stop you. So I thought of telling you. So nowadays, youngsters and especially new mothers, they